Hi, this is Dr. Doerr for Functional Soft Tissue, and video of the week is going to be for taping of the SI joint. So our FTMI for the SI taping, especially with rotational controls, is going to be very similar to what we've done associated with the forced closures when we did our evaluation and assessment video with the rotational problems with the SI joint. So we've already determined that our patient has a left PI ilium, and we've noticed that the forced closure for that left PI ilium got better either with the active straight leg raise or with lumbar ranges of motion associated with a pain provoked on those ranges of motion. So the tape job that we're going to do is going to be to help establish the proper neurologic stimulation of the fascia to control that rotational issue. So what we're going to do is we're just going to expose enough of the patient's pelvis so that we can tape right along the iliac crest. Ideally, we want to put the tape as close to the SI joint as we possibly can, but it's not mandatory. So we'll start with the PI side, and we're going to first attach the tape right over the sacrum, and then slowly bring the tape out right along the iliac crest. Then using our SPRT tab, we're going to place that tab as close to the SI joint as we possibly can, but it's more important to have enough room on the tape to attach to your second strip of glucotape than it is to be directly over the joint. So we're going to attach our second strip, catch the tab. Once again, we'll place our finger right in front of the tab, about 1/4 inch, and then just pulling that tab directly over our finger, and then we're just going to lay it down. Once again, that'll create a convolution right at the point where the tab is. Then on the opposite side, since the PI side is the first one we taped, this will be for the AS side, and we're going to just lay that tape down again, overlapping, making sure that we have some of the tape that lays directly on the skin so it doesn't peel off too easily. We're going to use a second tab, again as close to the SI joint as we possibly can. And because this is the AS side, we're going to pull our tab towards, helping to pull that fascia from anterior to posterior. And we'll use our second strip of tape, grab the tab again, placing our finger in front of the tab, we're going to just pull directly over, lay down our tape, and now we'll have the tab that's pulling the AS side posteriorly. On the PI side, it's pulling anteriorly, and what that's effectively doing is taking our iliac rotation issue and helping to reset it into its neutral position. So this is our functional taping for musculoskeletal injuries associated with rotational issues at the SI joint. Once again, I'm Dr. Doerr for Functional Soft Tissue. Look forward to seeing you at a class soon. And this is our taping video for Condition of the Month for SI joint dysfunction.